Hi everyone. So we proceed about the practical advice. Because communication is a two-way process, the first step in improving communication skills is to recognize that each of us has responsibilities both as a speaker and a listener. We need to improve our communication skills so that our listener recognize that each of us have the responsibility to speak loudly and clear. So we proceed to the speaker's responsibility. Be audible, speak loudly and out so that your listener can hear you without undue strain, and also be clear. We should speak loudly and clear so that our listener can hear it clear and also without undue strain. The next is be aware that your listener may not have understood you. In other words, acknowledge the many possibilities for misunderstanding as a normal part of every communication. If our listener will not understand what we are talking about, we need to have a patience to remind them what are you talking about so that our listener will satisfied on what we are saying. The next is be willing to ask questions of your listener to see whether he or she understands you. Offer the listener an opportunity to ask for clarification. Be willing to restate and clarify your message. Before we end our conversation with the listener, we should ask him a question that make him comfortable. For example, our listener have a problem about their mental health or etc. We as a speaker, we need to encourage our listener to voice out his or her problem so that she or he willing to open up, and after all, she or he feelings comfortable. We proceed about the listener responsibilities. Let the speaker know whether he or she is inaudible. Don't just sit there straining to hear. Ask the speaker to talk louder and if necessary to repeat the information you have missed. In this case, we need to example, I am the listener. So, as a listener, we have the right to talk in the speaker if it is not loud and clear, and also we have the right to repeat the information clearly so that we understand it. The next is let the speaker know that you are attentive. Look at the speaker, nod or shake your head. Your response does not have to be verbal, but you should react in some way that demonstrates that you are listening. You should let him to know that you are attentive by look at the speaker, and you should react in some way to demonstrate that you are listening. The next is, if the speaker message is unclear, let him or her know that you need a point clarified. However, be tactful and also be willing to accept some of the responsibilities for not understanding you. Be aware that you may not have understood the speaker. Don't be impatient if you occasionally do not understand everything. Misunderstanding and their subsequent clarification are a normal part of the communication process. Let's proceed to the communication habits to avoid. Don't use false reassurance. For example, if the patients admit to being fearful that the biopsy examination being performed will result in the discovery of the terminal cancer, avoid response such as, "I'm sure you'll be fine," or "everything is going to be okay." It is entirely possible, maybe even likely, that the patient's condition will not be fine. It is better to say nothing rather than the use of hollow statement. Don't ignore patient wishes. If the patient states that his right arm is the best place for starting an intravenous foreline, the technologist has two options. She can use the patient's right arm or at least look to see whether there is an adequate vein there, or she can explain why the left arm is a better choice. Don't speak like you are talking to a child. Be careful of your inflection. No one's like to be treated like a child. Many technologies fall into the habit of talking to the elderly in a sing-song voices, as if they were small children or as senile. This can be perceived as insulting and disrespectful. So we need to take note of this. Continuation. Don't assume that a non-responsive patient can't hear. A number of studies have demonstrated that the sense of hearing is quite complex, with much hearing occurring at the subconscious level. The lesson to be drawn from such research is that healthcare staff working with the seriously must always explain what is being done, at least in a simple terms, even if the patient does not appear able to understand. Don't carry on a separate conversation with a co-worker while a patient is present. This can make the patient feel like you view her as an object or anatomic part rather than as individual. To make the patient feel comfortable in sharing in the dialogue, the technology should explicitly invite the patient to participate, so that in this matter the patient is feeling comfortable. Don't think being professional means being cold. As technology improves, technologies have been forced to spend much of their time and energy staying current. Many healthcare professionals, knowing that patients feel comforted when they recognize that staff is competent, try to portray competency by behaving in a very cold, robotic way. It is important to remember, patients don't care how much you know until they know how much you care. Don't blame the patients. Blame decrease the patient level of self-confidence and most often result in the patients responding with the anger or defensiveness. Thus, blame is not an effective communication style. There is a subtitle but important distinction between placing blame and requiring the patients to accept responsibilities for their actions. We should not blame our patients. Perhaps we need to understand them at all. Don't use abbreviation or medical lingo. The use of medical jargon can confuse patient. Worse, if the patient knows knowingly to embarrass to admit he or she is baffled, you could risk getting an inaccurate medical history or at least of having unhappy, non-compliant patient. Use language that patients will understand with words that create mental pictures, common terms, and analogies. Communication habits to adopt. Be good listener. When surveyed, doctors interrupt a patient after just 18 seconds of the patient's description of symptoms. It is common for healthcare professional to ask a patient questions and then instead of actively listening to the patient, focus their attention on the form or chart in front of them. Use focus questions. Focus questions allow you to get directly to the relevant points and reduce rambling explanation from the patients. Use also the patient's name. It's been said that the most beautiful words in any language is a person's name. By using their name, you assurance the patient that he or she is now the focus of your attention. Unless they are much younger, it is best to use as a title such as Mr. or Mrs. or Miss when addressing the patients. Use touch to comfort and be aware of nonverbal message. Patients often judge the quality communications by both words and nonverbal such as handshake, eye contact, and the white spaces. When no words are spoken but an emotional or personal connection is made. This connection must be sincere and honest. A caring attitude can be stimulated. Develop a rapport with the patient, asking questions that have nothing to do with the examination at hand can show the patient that you are interested in him or her as an individual in addition to creating a connection with the patient. Communicating in this way often enhances the technology's job by allowing her to continually learn from her patients. The next is explain before acting. Never attempt to provide care until the patient understands exactly what will happen. Sometimes, in a rush to keep on schedule, technologies will just start a procedure. It is important to remember that delivering personal care without explanation and therefore a patient's consent has a name other than aid. It is called assault. Give the patient an opportunity to ask questions. After you have explained the procedure, give the patients the chance to clarify any points that may be confusing. Use reflective speech also. This is the technique is agreed for clarification of a patient's message. The last is give consistent message. Quality of care must be consistent across the entire staff and practice. Not some of the time but all of the time. Patients need to get unfiled message, printed materials, videos, and other forms of adjunctive patients education material provide a consistent message that also serve as documentation. That's all. Thank you.